$1 trillion was pointed out to me the other day, amounts to every second in 36,000 years. A trillion seconds in 36,000 years. That's what $1 trillion amounts to. And we're throwing it around at 5, 6, 7 trillion, 50 trillion, as if it's make-believe. Well, in fact, it is make-believe.
The one other quick thing that I think is really important for us to address for future needs, and we really haven't touched on it too much, and that's the issue of long-term care. And the home health agencies are really going to take a bath in these proposed pieces of legislation. Home health coverage inside Medicare is very slim, as many of you know. And of the total dollars spent in this country on long-term care, nursing home, home health, you name it, 5% is insured, privately insured. 5%, that's it. So the burden on you to take care of your parents is going to be staggering. It's going to be staggering.
Thank you for that. We have time for 3 more questions. Next question, please. And I'll ask the panelists to keep these a little shorter. I think we're going to...
Yes, my name is Glenn Sharp. I live here in Lubbock. And I just want to get something straightened out about Obamacare. Obamacare doesn't mean that they're going to pull the plug on grandma. What it means is they're just not going to plug her in the first place.
Thank you for that, sir. The next question, please.
My name is Mackenzie Brown. I am 17 years old, and I'm a proud Lubbockite. My question is this. It has been said there is a general shortage of general practitioners. So what is the motivation for a young student such as myself considering medical school but is afraid that I might not get a decent salary? What's the motivation for me to go to medical school with these proposed changes?
Dr. Cieli, Dr. Vessler?
Well, let me say something to that end. You see, the cost of going to medical school can be tremendous. For me, let me just be brutally honest, it was $600 a semester to go to Texas Tech Health Sciences Center. That is virtually free. My son is paying 6 times that per semester to go to Texas Tech undergrad. Now the issue then is, as you would want to go to medical school and become a general practitioner, and we don't have enough, the supposition is that this has to be supplanted by extended caregivers. Seems like a reasonable idea. Nurse practitioners, physician's assistants, okay? Here's the brutal, honest, ugly truth. They are fabulous for a sore throat and a little bug bite, and you got a cough, but your chest x-ray's clear. Anything else, forget it. And I'm not denigrating him. I just hired one to help me out. This is not a denigration of that. They had a wonderful article about a female physician in Lubbock about 6, 8 weeks ago that she delivered her 6,000th baby. And online in our Lubbock Avalanche Journal, this wonderful doctor was maligned anonymously on the blog because all the good work she did and all those poor people she took care of, now she has a nurse practitioner to see them, and these patients were livid that they didn't get to see her anymore. All she cares about is as much money as she can make, and all they did was see the nurse practitioner. You can't have it both ways, America. And our president doesn't get it, nor do our senators and congressmen, about what extended caregivers really mean, and they are valuable, but I just told you how they're valuable. They can't take care of you and see you and screen you before you see me. No, you can't do it. Understand that. So these people are going to be paid less. Sure, pay them less. You're not going to save any money because you're going to have to go from there to someplace else much of the time. Facts. Those are facts. So, knock yourself out.
Thank you, Doctor. This will be our final question from the audience.
Hi, my name is Amanda Havens. I'm also 17. My grandfather was recently diagnosed, battled, and won the battle with cancer of his colon. And he is afraid that if he gets cancer again, that he will simply be given a pill and told to go home and live the rest of his life with just a simple pain pill. Is this a problem that we face if this bill is passed?
I didn't quite understand.
Yeah,
Could you say your question again, please? I just didn't hear it well.
Right. If this bill is passed, and for my grandfather, who's in his late 70s, if he is diagnosed with cancer once again, will they treat him, or will they give him a pain pill and tell him to go home and say goodbye to his family?
Let me be honest with you on this, because this is where misinformation gets put out. He will be treated, all right? He will be treated, because the physicians that he has are not going to just let him lay there. Now, if your father has such an end stage level of that disease that there are no hopes, he would be offered hospice with palliative care, IV narcotics, and all of the support that is potentially given for that individual. So yes, he would get treatment. Absolutely, he would get treatment. And so it would be unfair to represent that this system, that even if a national health care plan would not take care of such a person. That's not necessarily fair on that side of the argument. He would be taken care of. It may be under certain rigid guidelines, but he would be taken care of.
Thank you for that answer, Doctor. Dr. Mayo, turn the mic back to you.